And how common is bruising in aesthetic treatment?
There isn't a lot of data out there on the incidence of bruising post aesthetic treatment, but from the data that I could find, it ranged anywhere between 1 in every 6 to 2 out of 3 people will experience some form of bruising post treatment, so it's actually quite common. Welcome to episode 5 of In Clinic. I'm your host, Danelle, registered pharmacist and lead aesthetic practitioner at Clinic One Medical Aesthetics.
And I'm Alex, co-host and marketing specialist at Clinic One.
On today's episode, we're going to be discussing some of the things that you can do at home to help reduce the chances of developing bruising. It'll help you aiding recovery post-treatment and allow you to avoid this common complication, allowing your results to become visible as quickly as possible.
So we've all had bruises before, but tell us why it's important for patients to follow pre-treatment advice to reduce the risk of bruising.
So in my experience, patients don't often necessarily want somebody to know that they've had an aesthetic treatment done. And it can be just one bad bruise that might be the reason as to why somebody won't come back and have treatment done again. So that's why it's really important that patients follow the pre-treatment advice given to them by their practitioner.
And how common is bruising in aesthetic treatment?
There isn't a lot of data out there on the incidence of bruising post-aesthetic treatment, but from the data that I could find, it ranged anywhere between 1 in every 6 to 2 out of 3 people will experience some form of bruising post-treatment, so it's actually quite common.
That's quite a lot, isn't it?
Yeah, it's actually more common than most people realise.
So what kind of things can contribute to a person developing bruising?
Well, firstly, anything that dilates the blood vessels and pushes your body's temperature beyond its normal parameters is going to lead to an increased risk of bruising. So things like rushing around before your appointment or going to the gym or exercising before your appointment are all going to predispose you to that risk. Also, if a woman is perimenopausal and experiences things like hot flushes, that again is going to be dilating the blood vessels and lead to a more increased risk of bruising. With respect to menopausal or postmenopausal women, they've experienced a drop in estrogen levels. Now, estrogen is very important in maintaining the thickness of the skin. So any woman who's menopausal or postmenopausal who has experienced that drop off in estrogen is going to again be predisposed to increased risk of bruising because of how thin the skin actually is. And then finally, people who have bleeding disorders or blood clotting disorders and liver disease, again, they're also at an increased risk. So there's quite a few different factors that can play into somebody having an increased risk of potential bruising post-treatment.
What about medications and supplements?
So when it comes down to supplements, things like garlic and vitamin E have been shown to decrease the blood's ability to clot. So this will increase the risk of bruising, of course. When it comes down to medication, things like aspirin, ibuprofen, and other non-steroidal anti-inflammatory medications, as well as any anticoagulants like warfarin or antiplatelets like clopidogrel, also hinder the blood's ability to clot properly and again increase that risk. And then alcohol consumption works in a very similar way as well. So all of these things can lead to an increased risk.
So would you advise that patients avoid certain things like medication, supplements, and some activities prior to their aesthetic treatment?
Well, there are definitely a few practical things that patients can do to reduce their risk of bruising prior to their treatment. So avoiding supplements and foods containing garlic and vitamin E will definitely help reduce the chance of any bruising. Consuming vitamin K, whether that be through supplementation or consuming things like dark leafy green vegetables, which are high in vitamin K, can actually help because vitamin K is important in allowing the blood to clot. So consuming that before your treatment will ensure that you essentially bleed less, which is going to reduce the risk of bruising overall. For patients who are taking over-the-counter painkillers such as aspirin, ibuprofen, and naproxen, these should be discontinued 1 week prior to treatment, but this should only be done if these medications aren't being taken for a serious health condition.
So what about in the clinic? Is there anything you do to reduce or manage the bruising?
So certain aesthetic treatments can be performed with a cannula. Now this is essentially like a long needle with a round blunt-ended tip, and it'll find its way through the tissue taking the path of least resistance, unlike a needle which will just pierce straight through any vessel that it encounters. So this is a good way that we can help reduce bruising. I also use arnica cream post-treatment, which is a cream that helps dissolve any bruises that might form. It also has really good anti-inflammatory properties and aids in the healing process. So this is another way that we can help just keep that bruising at bay as much as possible. If you'd like to put yourself in for a consultation or find out more about the different treatments that we offer, click our Linktree link in the description. This will take you directly to our Linktree where you can contact us via WhatsApp or download our treatment guide directly to your device.
Don't forget to like and subscribe if you've enjoyed today's show. Hit the bell if you're watching on YouTube to get notified when our next episode is out, and leave a comment if you have anything interesting to say. Thank you for watching.